Hello, welcome to ANA community. In this particular video, we are going to discuss Sparshanendriyataha Pariksha. The term Sparshanendriyataha Pariksha refers to the use of Sparshanendriya of the clinician or of the Vaidya to do the Rogi Pariksha. As far as Sparshanendriya Pariksha is concerned, Sparshanendriya of the clinician, as we have discussed earlier, or the surgeon, has to be used to assess the analysis of Rogabala and Rogibala. Of course, so here, what are the things they are going to get assessed while doing the Sparshanendriyataha Pariksha is, the most of the occasion, the persons will be complaining of swelling. For example, knee joint swelling or ankle joint swelling or any kind of the trauma has occurred in the hand, etc. That will be associated with swelling. So that particular swelling, so you need to know about what about the extent of that particular swelling. What will be the length of the swelling? What will be the width of the swelling? What will be the depth of the swelling, etc. For that, we are going to use the Sparshanendriya or the hand of the clinician, and whether it is soft or hard, etc., that will be analyzed by sparshan using the Sparshanendriya. Warmth of the body part, whether it is cold or hot, that means whenever if you touch the body part, you may get the warmth, in the sense there may be a possibility increased blood circulation towards that particular part. Coldness, in the sense reduced blood circulation. So that means the temperature of the body part can be analyzed by Sparshanendriya. Regarding the eliciting the different signs mentioned in the different systemic examinations. For example, in case of musculoskeletal system examination, analyzing the what do you say that the crepitus, we have to use Sparshanendriya, or stiffness of the joint, we have to use the Sparshanendriya, hypertonia or tone of the muscle, as such, that has to be analyzed by Sparshanendriya. Papules, in case of the integumentary systemic examination, so we are going to use the Sparshanendriya as such. Eliciting the tenderness of the body part. Suppose if the person is having a severe body pain, specifically in knee joint, that may be the person may not be in a better position to move the joint, and if it is very severe, the patient will not allow you to touch the joint also. So that is the, if you are going to analyze tenderness as such, we have to use this Sparshanendriya. Normality and abnormality of the body parts during the breathing discomfort. So whether it is related to any kind of the what do you say that the tenderness, whether is it due to the, whether this particular breathing discomfort may be due to musculoskeletal involvement, for example, costochondritis, etc., or the person is having electrolyte imbalance during the cough as such, that has to be checked by Sparshanendriya itself. Text says, Sparsham cha panina prakriti vikriti yuktam. Whenever if you are doing this Sparshanendriya Pariksha, that is pani, that is the hand of the clinician, has to be used to know about the normalcy and abnormalcy of the body and body parts. Further, it is being mentioned in the Ashtanga Hridaya, the commentary of Arunadatta, that says, Sparshanena hastakaya sparshena, Jwaragulma vidradhyadyartam, Tatha Shitoshna Stabda, Spanda, Shlakshna Kharasparshadikam cha. Sparshanena hastakaya sparshena, that is, the hand of the clinician is being used. Which are the clinical conditions? Jwara, to know about the presence of the jwara, raised body temperature, we are going to say the pitta dominance has to be analyzed by the hastakaya sparsha. Gulma, specifically it is a spectrum of the disorder where the udara or the kuksha pradesha will be afflicted. To know about the nature of this particular gulma, we have to do the Sparshanendriyataha Pariksha. Vidradhi, that is the presence of puya in the body part. So this will be associated with the raised body temperature locally, or the person will be having severe tenderness on palpation. That has to be known by the Sparshanendriya itself. Shita, coldness; Ushnata, warmness; Stabdhata, stiffness; Spandaha, that means abnormal pulsations; Shlashna, sliminess; Khara, roughness of the body parts, has to be analyzed by Sparshanendriyataha Pariksha. Sparshanena shaityadikam cha, that is Sparshanena shaityam adikam. So that means by the Sparshanendriya, shaitya or coldness etc. will be analyzed. Sushruta says, Sparshanendriya vidnyayaha shitoshna shlakshna karkasha mrudukathinatvadayah sparsha vishesha jvara shofadishu. If you split this, Sparshana indriya vidnyayaha shita, ushna, shlakshna, karkasha, mrudu, katinatva adayah sparsha vishesha jvara shofa adishu. In a sense, the person, if you are looking into that is Sparshanendriyataha Pariksha, we are going to use that particular type of the Pariksha in case of the assessment of Sheetatva, coldness; Ushnaha, warmth; Shlakshnaha, sliminess; Karkashaha, roughness; Mrudu, softness; Katinatva, hardness of the body parts. The clinical conditions such as Jvara, Shofadishu. Person is suffering from the fever where the Pitta dominance is being analyzed, whereas the Shofaha, where Kapha dosha dominance associated with Vatanubandha will be assessed. For example, different examples of Sparshanendriyataha Pariksha. So here, one example, the person is doing to do the knee joint examination. Whether is there any tenderness is being present or not, that will be analyzed by touching the patient itself. In case of this particular aspect, that is the non-pitting or non-pitting type of edema, so that has to be analyzed by looking into the Sparshanendriya itself by using the hands we can able to assess. Regarding the assessment of the Rukshatva, so here in the extreme left image, the Rukshatva may be milder, whereas the extreme right image, where the skin lesions are being observed in the widespread body part itself, so Rukshatva will be observed to the maximum extent. Similarly, Snigdhatva has to be analyzed; Sheetatva or coldness; Ushnatva, that is warmth; Mrudutva, that is softness; Katinatva, that is hardness, etc. That will be analyzed by Sparshanendriyataha Pariksha. Take-home messages from today's discussion are: so here, hand of the clinician or the examiner is being used in the performing the Sparshanendriyataha Pariksha. Status of edema, warmth of the body part, character of the swelling, etc. will be analyzed with this kind of the Pariksha. Don't simply touch the patient, you have to observe the patient itself. In other words, listen to the patient with 100% attention, with your eyes, with your hands, with your nose, and with your ears. So that will be giving you the accurate diagnosis. Dear community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.